I'm sorry. It is a phrase that could soon mean fewer medical malpractice lawsuits. Under a new state bill, healthcare professionals would be allowed to say, I'm sorry, when a procedure goes wrong without that being considered an admission of guilt. Stacia Mullaney explains that doctors think it's a step in the right direction.
We all make mistakes, but when doctors do, it's not as easy for them to say, I'm sorry.
Anything you say can be held against you, and admitting that you're sorry has maybe some implication of guilt or that something went wrong.
But under a new bill proposed by Senator Jim Marleau, when something does go wrong, saying I'm sorry could no longer be used as an admission of guilt in civil lawsuits.
It sort of seems antiquated that we don't allow our healthcare providers to tell us as patients that they're sorry when something goes wrong in a procedure.
35 states already have what Senator Marleau calls I'm sorry laws, and reports show the number of medical malpractice lawsuits have decreased in many of those states. That's why the Michigan State Medical Society hopes our state will be next.
Nobody likes to make mistakes, and certainly we don't like to cause harm, but it happens. To say I'm sorry might avert a lawsuit.
Something Marleau agrees with.
It definitely will. It definitely will.
And Marleau hopes fewer lawsuits will eventually lead to lower insurance premiums as well. But first, he just wants to help healthcare workers and families.
To bring closure to families, because if they hear those two words, sometimes that can mean a lot.
Mean a lot and likely save a lot in unnecessary lawsuits. In Lansing, Stacia Mullaney.